Cognitive decline is no longer just a personal tragedy, it's becoming an economic one. As global populations age and dementia rates surge, a growing body of research points to an unsettling accelerant: the air we breathe. Long associated with asthma, heart disease, and early death, air pollution is now being tied directly to neurodegeneration, memory loss, and dementia, particularly in cities and industrialized regions. And while the health impact is harrowing, the financial toll is staggering. Air pollution-induced cognitive decline is quietly becoming a massive burden on global healthcare systems, draining public resources, exhausting caregivers, and threatening to overwhelm already fragile infrastructures. Let's start with the numbers. In 2023, the World Health Organization estimated that over 55 million people worldwide live with dementia, a number expected to double by 2050. Of those, a growing share, especially in urban areas, is believed to be influenced or accelerated by environmental exposure, particularly to fine particulate matter, PM2.5, and nitrogen dioxide and O2. These pollutants are now implicated in faster cognitive aging, smaller brain volumes, and greater risk of both Alzheimer's and vascular dementia. That means more diagnoses, earlier onset, and more years spent in cognitive decline, all of which come with a steep price tag. In Europe alone, dementia-related costs already exceed €250 billion annually. In the US, the figure passed $350 billion and is projected to hit $1 trillion by 2050. These totals include direct medical expenses, doctor visits, diagnostics, hospitalizations, and medications, as well as indirect costs like long-term care, home assistance, and lost productivity from family members who leave the workforce to become caregivers. Now, factor in pollution's role in pushing more people into cognitive decline sooner, especially in low-income, high-exposure neighborhoods, and the math turns bleak fast. What's especially troubling is that pollution-induced dementia disproportionately affects people who are least equipped to manage it. Communities living near highways, industrial zones, and traffic-congested urban cores not only suffer from higher exposure, they often have less access to early diagnosis, specialist care, and support services. This creates a perfect storm: more dementia, diagnosed later, managed poorly for longer. That's not just a healthcare crisis, it's a social destabilizer. The economic drag doesn't stop at hospitals or nursing homes. A cognitively impaired population means reduced workforce participation, increased disability payments, and heavier burdens on informal caregiving networks, often made up of unpaid family members. The OECD has warned that dementia-related care will soon consume a larger share of GDP in middle and high-income countries than cancer or cardiovascular disease, unless prevention efforts are stepped up. And air pollution is one of the most preventable contributors we have on the table. Unlike genetics or age, air quality can be improved through policy. Emission controls, green infrastructure, cleaner public transit, and urban redesign all have the potential to reduce exposure, especially in cities where the concentration of pollution is highest and where the greatest gains in brain health could be made. In fact, several economic models suggest that even modest improvements in air quality could save billions in long-term healthcare costs by delaying the onset of dementia in aging populations by just a few years. And yet, this link is still under-recognized in public health spending. Most dementia prevention strategies focus on lifestyle factors: diet, exercise, cognitive stimulation, while ignoring the air people are breathing every minute of their lives. Pollution rarely makes it into dementia policy briefings, even though its reduction would benefit far more people, far earlier in life, and across entire populations. This omission is not just short-sighted, it's fiscally reckless. Because without intervention, we're heading toward a future where cities will be full of cognitively impaired adults aging in place, straining every available system. Hospitals will be overbooked, assisted living facilities overwhelmed, and national health budgets stretched thinner than ever. Families will burn out. Productivity will dip. Mental health crises will spike. And all because we failed to take seriously the cumulative brain damage caused by the air that flows through our lungs and quietly settles in our minds. So the cost of cognitive decline isn't just medical, it's systemic. It's the price we pay, year after year, for not cleaning up the skies. And unless we act, the tab will come due not just in dollars, but in minds lost too soon, and futures cut short before anyone even realized the damage had begun.